My name's Stephen Neal. I'm a professor of microengineering at the University of Glasgow. And my expertise is in microfabrication. So we make small electrodes that work as sensors on implanted medical devices. My background is in micromanipulation, that's moving around microscopic particles. And we do this with patterned electrical fields on sets of electrodes. And this gave me insight into what happens when you put cells onto microelectrodes, which led to this work on working with medical implants. So we're interested in cardiovascular implants that have a common problem in that they block. So we work with stents and we work with grafts. And both of these implants have problems when there's an accumulation of cells which creates a blockage within the implant. We can put electrical electrodes on the inside surface of the implants, and that can then sense this blockage. And depending on the implanted device that we're working with, it can be an early warning of a problem that's developing. We also have the ability to try and reduce a blockage. If we put higher electrical fields across the same set of electrodes, we can then reduce the amount of cells that are built up. With this technology, we can then do surveillance at home. This means that the patient doesn't have to come into hospital as much. It could also give us an earlier diagnosis of a problem occurring, so that would be better for patient health. Our sensors work by using electrical impedance, and this is a very elegant sensing technology. As the cells build up along the electrodes, the impedance across the electrodes increases, and so we measure that as a very direct measure. But our key novelty is then being able to put a higher electrical field across the same electrodes to be able to reduce the blockage. And so this hasn't been done before. So I'm part of a collaboration called VascuX. VascuX is led by my collaborator, John Mercer, who's a cardiovascular scientist. VascuX is a pre-spin-out company at the University of Glasgow. We're going through the Scottish Enterprise high-growth spin-out route, and we're currently applying for company creation. I met John at a workshop on age-related disease. My work was looking at the stiffness of cells and how this changes with aging, and John was interested in the cardiovascular effects of old age. Part of my work was using electrical fields to destroy cells. We could see how we could electrically lyse, completely destroy a cell. And John immediately saw the benefit of this if we could have that technology built into a vascular implant like a stent or a graft, how effective that could be at reducing blockages and reducing ill health. I think that the collaboration works because we're both willing to go outside of our comfort zones, and patients that have gone through multiple interventions to improve their vascular access have a very poor quality of life, and our technology is designed to improve that.